Hello, everybody. Welcome to another episode of Health Podcast, and I'm here with
Dr. Monique Foster.
Dr. Monique. Thank you for coming in the show.
Mm-hmm.
So, before before we move to the first question, I appreciate your work very much that you have done in Sierra Leone, and I want to say thank you for coming in. So, let's start with our first question. I don't know if you want to share a little bit of your background and what sparked your interest in public health.
Sure. So I am a pediatric infectious disease doctor by training. I have a medical degree. When I was studying about infectious diseases and getting that extra certificate or that extra degree in public health, I decided to apply for a fellowship at US CDC in Atlanta. It's very similar to the field epidemiology training program. It's actually the program that the field epidemiology training program here in Sierra Leone is based on, called the Epidemic Intelligence Service, or EIS. So that was a program that really taught me how to apply what I had learned in the classroom to the field and field work in public health. So I what sparked my interest is the shift from taking care of an individual like you do clinically, like I do as a physician, to taking care of the health of a community or a population, which is what public health is.
Okay, so public health is a broad term. I don't know if you would like to define it for our listeners and what are the most critical components.
Yeah. So again, public health is the health of a population and keeping up an entire population healthy. For me, the critical components of public health are outbreak response. So kind of what you're seeing with the Mpox response, making sure that outbreaks are contained and stopped. Data and surveillance. So looking at all health data as it comes in, so you can see if any outbreaks are happening, if you see any signals that show that the health of the population is not at its best. And then program management. So program management is things like the malaria program or the HIV program, programs within health that are big and have a lot of resources and a lot of components that have to be managed.
Okay, thank you. That moves us to the next question. I have known you've been working here since Ebola and COVID. I don't know if you can give us like a vivid memory of the moment you realized the pandemic will completely change how you work and what was your first step to adapt during the COVID?
Oh, yeah. So COVID, I was still in the US for the first part of COVID in 2020 when it started. I moved here to Salone in 2021, kind of in the middle of the pandemic. But I think I first realized that it was something serious when there were the lockdowns. So when I was in the US, I still had to work. I still had to go places to ensure that the proper outbreak response is happening all over the US. And that required me to travel, to different parts of the country. What was striking to me was to go through an airport that was completely empty. Like, I travel quite a bit. I'm used to traveling for work. I travel for pleasure. It's something that my husband and I like to do. So going into an airport and being the only one there was very shocking to me. And I think that's when I realized that it was something serious. Being on a plane and being one of only like 3 or 4 people was very shocking. So I think that the lockdowns was when I knew that it was something serious.
Okay, so this takes us to the next question. How was working during the pandemic affect your stress level and anxiety?
I think it's stressful in that you're working and you might be exposing yourself to sick people, but you're still trying to take care of your family at home, and then your extended family, your parents, your siblings, your friends. So and then when you're in the jobs that we do about public health and something like this occurs, people are coming to you asking questions, and you might not know the answers yet. They think that you know something that everybody else doesn't know because of the work that you do, and that is not always the case. So trying to explain to them what you know at the moment, and how you are protecting yourself and your family uh, is the best that you can do at the time.
Okay, thank you very much.
Mm.
Interested. So we have a little issues about misinformation
Mm.
in the health sector that disturbs Sierra Leone moreover.
Mm.
So I want to know what role does misinformation play in undermining the health security and how can public health officers manage it effectively during crises?
Yeah, misinformation is one of the biggest challenges to any public health emergency or public health in general, and it's because it can it can interrupt the trust that the public has with a public health official. So anything that you do or anything that you recommend has to start with the trust of the people that you're recommending it to, right? So if the public does not trust me when I say that a certain intervention has to occur, whether it is isolation, staying in your house, getting a vaccine, if they don't trust what I'm telling them to do will protect them, then they're not going to do it. And if they don't do it, then maybe we see a worsening of an outbreak or a transmission of a deadly virus like Ebola. So really, this information comes down to a lack of trust. If people believe something that's not true and they don't believe what I'm trying to communicate with them as far as interventions to make them get better, then it just prolongs whatever health emergency that we're in.
Okay, thank you very much. So
Oh, sorry, I didn't answer the second part of your question, which is how to combat that.
Yes,
So,
sorry.
to back up. So yes, the best way to combat misinformation is to really build the trust. You have to have the trust before the emergency starts, ideally. And then when the emergency happens, you just have to have clear communication.
Okay.
You have to communicate frequently. You have to use plain language that people understand. You don't want to be talking like an expert if people don't understand what you're saying. And then you have to have bilateral communication. So you communicate with your community, the community communicates back to you to tell you what is working, what they can do, what they're willing to do, what they're not willing to do, and you have to discuss just a compromise of those things to get to a place where you're both doing an intervention that stops the outbreak, but doing it in a way that's comfortable for the community. Because if you're recommending things that they're not going to do, then it's pointless.
Okay, thank you. Let's move to more of preparedness and all. So, what lessons have you learned from the past outbreak, like Ebola and the COVID-19 pandemic, and how will it shape the emergency preparedness plan for the future?
Oh, yeah. So the biggest thing is being prepared before the outbreak occurs.
Okay.
So I think that Sierra Leone, unfortunately, because of the experience of Ebola, I say unfortunately because they had to go through that experience to then become prepared for future outbreaks. So I think going through Ebola has prepared the country to be set up where they can handle a large outbreak response. I was here during Ebola, as you mentioned. I was one of 1,500 deployers that came from CDC alone, and the country really required a lot of external help. When COVID happened, I was here again during COVID. It did not require thousands of people coming from the U.S. or people coming from outside to help because the country was better prepared in having a educated public health workforce through the FETP program, better prepared in that it had digital disease surveillance systems so they can see exactly what was happening once the first confirmed case of COVID arrived in Sierra Leone, and then better prepared in having rapid response teams to respond to the outbreak and a system in place to get vaccine, to get people vaccinated.
Okay, thank you very much for that one. Mm-hmm. So this takes us to the next question because we are fighting for this One Health approach. Okay, so how can One Health approach integrate human, animal, and environmental health in improving our response to public health emergency?
Yeah, I think that we always talk about the One Health approach and integrating these three areas: human, animals, and environment. And we kind of speak as if those aren't already connected. They're already very connected, and there's nothing that we can do to make them interconnected because they're already interconnected. So it really is, how are we going to acknowledge that connection already exists? For example, the environment, climate change. With the warming of the planet, it causes animals to move from where they are to new environments, or maybe deforestation will cause animals to move from where they're used to living to have more interactions with humans. Well, 90% of diseases that cause outbreaks are what we call zoonotic diseases, diseases that start in animals and then leap to humans. So that interaction between the environment being changed in a way that causes animals to move closer to humans, that causes the diseases of the animals to jump to humans and cause outbreaks, it's already there. So the best that we can do is monitor things. We can monitor the changes in the environment. We can monitor diseases that happen within animals, and we can monitor our own self to see what effects those diseases have on us. So the best we can do is collect data and try to see if any of those quote unquote what we call spillover events happen where diseases will jump from animals to humans. But really it is having the awareness that these things are already interconnected and collecting the data in a way that we can intervene if something that is dangerous to any part of the three occurs.
Okay, thank you very much, Edward. This takes us back to what you mentioned previously. Still coming on this communication. So how can public health officials better communicate the risk to the public without causing panic or distrust? Because we have issue with communicating with the public, more over the social media, misinformation. So I don't know if you can enlighten us on that.
It just goes back to what I said before. Like you have to have an underlying level of trust.
Okay.
And that's for the public health officials, the community for the public health officials. They have to be seen as a trusted source of information, number one. Number two, the communication has to be clear. It has to be consistent, and it has to be often. Things change. Sometimes we're saying to wear masks. Sometimes we're saying not to wear masks. So anytime changes happen, we have to communicate that, and we have to communicate why the change was made. It has to be clear. It has to be, again, in a plain language, not jargony. I wouldn't speak to the community like I speak to people when I'm giving a scientific conference. I wouldn't use all these splash words and make it very complicated. People just want to know what they can do to protect themselves and their family. So use plain language, clear language. And then again, the communication has to go both ways. The community, you have to be available as a public health official to listen to the community and civil societies, because you might think something works for you and it makes sense in your mind, but when you present it to the community will say, no, that doesn't work for us. Like that doesn't make sense to us, and we're not going to do it. And if they don't do it, then no one's being helped, no one's being protected. An example is during Ebola in America, the coverings that we use for people who have died are black, right? So, we cover the body in black and we take it away. And we found that in Sierra Leone, it was shocking. Like no one wants their family member to be covered in a black bag, right? So that takes talking to the community. The community has to say, no, wait a minute, this is not appropriate. We want to honor our loved ones who've passed away. We understand that we can't do what we normally do because there's this infection that is spread if the burial is improper, but is there a way that we can do this without this black covering, without this black bag? And yes, there's a way to do it where you're not, you don't have to use a black bag. You can use a white bag. You can do things that you're still protecting people from the virus by ensuring a safe and proper burial, but honoring people's customs. So the communication has to go both ways to build that trust and to combat that misinformation.
Okay, thank you very much. That was a good one too. What are the biggest challenges in balancing individual freedom with collective health security measures being public health emergency?
Yeah, I mean, I know I'm saying it over and over again, but it really is trust. Like again, every individual's action during a public health emergency can impact the population as a whole. So it really, the interventions that we have are usually individual based, like staying home, isolating yourself, getting a vaccine. Those are interventions that are required for the individual to do to protect the whole. The individual is not going to do those interventions if they don't trust what the person is telling them is correct. Why would I stay home when I need to go to work and make money to feed my family if I don't trust that that's the way that this stops the outbreak? Why would I get a vaccine, a Maclet, if I think that it's dangerous or someone has told me it doesn't help, it doesn't do anything? So to get individuals to take on that intervention or activity or action to protect the health of the whole, it really depends on if that individual trusts the official that's telling them to do that action. So I think that's the most challenging part, is to ensure that we are trusted, and the recommendations that we are making are evidence-based. They're based in science. They've been shown to work. And if something changes, we communicate that change and why that change was made as quickly as possible.
Okay, thank you very much. So, I don't know if you can leave one message out there for people that are going to watch this video about health security and how to keep themselves safe.
I don't know. I guess my one message is health security is national security. When we are safe from diseases, when we are a healthy population, then that makes us safe and secure. It's to me no different than actual military security. It's just as important for a nation to be healthy and to be safe from diseases, because that makes us more productive. It really is the basis of everything else. You can't learn if you're not healthy. You can't earn and do your work if you're not healthy. You can't protect your family if you're not healthy. So I think health security really is foundational to everything else.
Okay, thank you, Dr. Monique, for coming in. Thank you very much. I really appreciate you.